What is a normal brain function? The brain controls all functions of the body. It helps to perform vital operations such as breathing, maintaining blood pressure, or releasing hormones. However, during the consumption of drugs such as alcohol and caffeine, there are many side effects on the brain which affect performance of a person or cognition. What effect can alcohol have on us? Drinking alcohol has effects on a range of functions controlled by the brain, including memory, reaction times, concentration, balance and coordination, speech, and mood. These effects can be seen if the person drinks once or twice. However, if the person drinks excessively over a long period of time, these effects will linger long after the person has become sober. Examples of this could be from simple moments of blank memory, or it could be more serious and permanent, which will need extensive treatment. Factors influencing how and to what extent alcohol affects the brain include how much and how often a person drinks, and the age at which a person has started drinking and how long the person has been drinking for. The negative effects of drinking will generally reverse, as the alcohol is processed and removed by your body. But if alcohol use is continued on a regular basis, some of the effects will become worse and can even become permanent. What is cognition? The term cognition refers to mental processes like thoughts, memory, problem solving, and decision making, to name just a few. The ability to engage in cognitive processes is described as cognitive functioning. The term cognitive impairment refers to problems and difficulties in one or more areas of cognitive functioning. Therefore, when drinking alcohol, a person's ability to function cognitively is not as precise when sober. Research has shown strong links between long-term heavy alcohol use and impairments in cognitive functioning, like slow processing of information, difficulty in learning new things, and reduced problem-solving ability. The more you have been drinking, the greater the impairments will be. These effects are due to damage caused by alcohol in numerous ways, such as wasting away of brain tissue, development of scar tissue in the brain, or chronic vitamin deficiencies. In most cases, staying away from alcohol for about 3 months can revert the brain to normal function. However, if there is a more serious case of drinking, the effects of alcohol abuse could be permanent. What parts of the brain are affected? Hippocampus. This is the part of the brain that stores memory. Therefore, even a small amount of alcohol can make teens forget what they did or learned while they were drinking. This is mainly due to the maturing hippocampus during adolescence, which means that it would not be as developed as adults and will be more prone to the effects of alcohol. Cerebellum. This part works with the primary motor cortex to control movement, balance, and complex motor functions. Drinking alcohol can decrease motor function and slow reaction time. For example, when a person is drunk, he or she may not be able to stand or walk in a straight line. Therefore, when drinking excessively, motor skills are not like when the person is sober. Frontal lobe. This section controls judgment, behavior, and emotion. Alcohol may affect emotions, leading to crying, fighting, or a desire to be closer to another person. Reticular activating system. This part is in the midbrain, and it controls sleeping and walking. Alcohol can depress these systems, causing a person to pass out. Medulla. This part is in the hindbrain. It controls heartbeats, breathing, and other functions. During heavy drinking, these may slow or stop working altogether, endangering an individual's life.
Caffeine. Caffeine exists naturally in certain plants, but can also be created synthetically. When you drink caffeine, your body absorbs it very quickly and passes it to your brain. According to Medline Plus, a service of the Natural Institutes of Health, the drug does not accumulate in your body and gets excreted through your urine after several hours. However, with caffeine, although it is a drug, it does not have any evidence that shows any damage done to the brain. It is in fact that there are studies that show that it might actually cure the brain. Caffeine is believed to be able to protect people from the mental decline with conditions such as Alzheimer's disease and dementia. People who drink it regularly were less likely to experience declines from these diseases, rather than normal people who did not consume caffeine regularly. In caffeine, it is able to hijack the process that your body goes through because it looks a lot like adenosine. This is because of its similar shape. Caffeine can bind to the adenosine receptors in your brain. Once the caffeine is locked into adenosine's rightful spot, though there is no way for the adenosine to stick around, which prevents it from building up and makes you sleepy. When the adenosine is continually blocked from binding to its receptors, your body eventually creates more receptors, which means you need even more caffeine to plug them up. This can make kicking your coffee habit increasingly difficult and make you need more and more caffeine to stay alert. Parts of the brain affected by caffeine. Activation of frontal lobes. Dr. Florian Koppelstadter and colleagues from the Medical University Innsbruck in Austria presented a study in 2005 that shows that taking caffeine can activate the frontal lobes of the brain. These areas are responsible for short-term memory and attention, and therefore caffeine would increase it. Slowed hippocampus function. This effect is more of a long-term effect. Long-term consumption of caffeine can slow the functions of the hippocampus. This part of the brain is responsible for long-term memory and learning. Although caffeine can improve a person's short-term memory and focus for a short period of time, it is gradually slowed down learning and memory by decreasing the function of the hippocampus over time. Mental health problems. Alcohol abuse or excessive drinking can cause problems such as depression, anxiety, antisocial behavior, psychosis, and these can usually last for several weeks. Most of these diseases are negative. However, when compared to caffeine, it is shown that caffeine reduces depressive symptoms and a lesser risk towards suicide. But studies on effects on depression and ADHD have not been studied sufficiently.